Well, conquerors, greetings to you all. Hey, 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 hey. It is the red and it's the blue, baby. We're back, aren't we, Maya?
Are we back?
We are back. We are back from our break. Good morning, good afternoon, good evening, wherever you all are in the world, wherever you're tuning in. Welcome to all of our viewers. A warm welcome to the TCJ Co'LAB 2K25, where we don't compete, rather we collaborate, right?
That's right.
That's it, right? To all of our conquerors out there who are watching, you are tuning into the June segment of our third segment of the TCJ Co'LAB. And we thank you and we appreciate you all for tuning in. So I am your host this evening, Aisha, a young lady young.
And I'm your co-host, Maya Fire Renewed Morgan. Welcome in.
Woo, woo. Love it. Love it. Love it. Welcome in, everyone. Once more to all of the conquerors who are out there viewing this broadcast. You are tuning into the June segment of the TCJ Co'LAB. We thank you so much for tuning in, and we pray that if you have a willing ear to hear what the Spirit of the Lord has to share here on this ministry platform of TCJ, stay tuned and stay locked in. As the host of the TCJ Co'LAB, Maya and I, we are reminding all of our conquering viewers that the TCJ Co'LAB is a monthly virtual ministry collaboration designed to help each of us to break free from unhealthy patterns and inherited from our inherited family of origin and our generational bloodline. So we feature passionate professionals and experts who provide insight and tools to help us conquer and win in every area of our daily wellness, including physical health, fitness, nutrition, mental wellness, finances, and relationships.
Yes, indeed. And what you can expect during your tuning into our virtual collab discussions is that we'll introduce our guests and their expertise. We're going to touch on some root causes of various dysfunctions based on the topics of our segments. And then in our collab, we'll show you how to embody being more than a conqueror by breaking away from inherited and generational cycles of dysfunction. And we will even conclude our guests sharing with you, our viewers, how they can be contacted in the case that you'd like to connect with them at any of their upcoming events or their private practices. And our hope in this collab is that one of our guests and their expertise become the answer that you're looking for. So we encourage you to stay tuned for more upcoming segments.
Stay tuned for more upcoming segments. Okay, we rocking out the rest of this 2K25 year. All right. So again, welcome to our June segment here at the Conqueror's Journey, TCJ Co'LAB. Tonight is entitled Our Physical Wellness Journey, which is part 3 of our 4-part health and wellness series. So if you're tuning in for the first time, we admonish you to hit that rewind button and go and see our previous segments 1 and 2, which focused on our mental health and our nutritional health journeys, right? Those segments were really power-packed, right? With information that guarantees us to be more than conquerors in what we consume mentally, as well as what we consume on our plates, right? And what we ingest when we eat on a daily basis. So you truly don't want to miss out on how our 4-part health and wellness series inclines with a wealth of information from our professional experts and our gurus, right? So as we continue to focus on being more than conquerors, Romans 8:37, y'all know that's our foundational scripture here at TCJ. It challenges us on tonight specifically to bridge the gap between medical understanding and holistic yet empowered approaches to our health, right? So 3 John, the 2nd chapter, right? Amplified Bible. It says, "Beloved, I pray that in every way you may succeed and prosper and be in good health physically, just as I know your soul prospers spiritually. And with that said, our physical wellness journey discussion tonight is designed to encourage all of us conquerors to think deeply as our medical professional guests share their professional and personal insights and assist us in connecting the dots between medical science, personal habits, and spiritual strength. So, Maya, shall we welcome to the virtual stage our medical professional guest for the evening?
Yes, we shall.
Come through. Yes. Welcome.
To our guest today. Welcome to the virtual TCJ Co'LAB. Yes. This is our lovely Dr. Naomi Hugh. Yes. And this is our settler slayer, Kim McCargo.
Yes. We're going to find out about that in a minute.
So as a brief intro for us all to get to know you, can you briefly share with us something that makes you uniquely you, and also share one fun fact about yourself? And we'll start with Dr. Naomi.
Yeah. Something that makes me uniquely me. I am always joyful. As a matter of fact, the name Naomi means pleasant. And sometimes people really question my joy, my peace, my pleasantry. But I do believe that there is something in the name, and that my spirit is a quiet and a soft spirit. But I am always pleasant and joyful. I just can't help it. It's the way that I was created.
That's
and
right.
one interesting fact about me, if I could go back to school, I would go back for carpentry.
What?
Yes.
Right? Never would have
Carpentry.
thought that.
You gotta know the meaning of your name. And really trying to be made in the image of Jesus. Huh? She said he was a carpenter. I think I could do it too. I love it.
Yes.
Okay, Kim, can you briefly share with us something that makes you uniquely you, and also share one fun fact about yourself?
What makes me uniquely me, and Dr. Naomi took a little bit of mine, but I'll move on to, I am a natural encourager. I tend to encourage. I am probably everyone's best cheerleader. I love when people win, and I love just being the person there to cheer them on, to encourage her. I mean, one of my gifts is exhortation. And I did not realize that, and Dr. Naomi hit it when she said, some people don't understand it because they think you're kind of fake, or they think something's going on. I'm naturally happy, I'm naturally joyful, and I'm naturally going to always cheer you on. That is just who I am. But I had to learn it, right? And the one thing about me is, I guess we talked about the subtle slayer. I'm an author. I became an author a year ago. Just celebrated 1 year as an author. So
awesome. Congratulations.
So thank you. So I am the author of Save Doesn't Equal Settled for Less. That's the one thing about me.
All right.
Love it. Amazing. Listen, I know that y'all know the Bible scripture that talks about us being fearfully and wonderfully made, right?
Yes, ma'am.
So as we always do, we admonish all of our conquering viewers to take time to intentionally self-care and internally and externally find out what your name means, right? Find out, what you were created to do to really impact other people, right? Regularly, and just affirm and declare over yourselves what God's word says about you, because definitely we all are fearfully and wonderfully made. He made us uniquely us to be us and give him glory, right? So I appreciate so much our guests today for sharing how God has created them uniquely and fearfully and wonderfully. That's amazing awareness. And thank y'all for sharing that with us. Thank you so much. So we are moving forward in our discussion tonight. And I want to reiterate again to the TCJ Co'LAB viewers that are connecting our foundational scripture, right? that helps us connect the spiritual truth to TCJ's foundational truth is also Romans 8:37. Yet in all these things, we are more than conquerors. So that is our foundational scripture. And it speaks to the struggle of dysfunctional physical health specifically tonight in our discussion. And so as our expert guests provide practical and insightful and spiritually grounded advice to empower us to break free from dysfunctional physical health and embrace a mindset of being more than conquerors in our relationship with our physical bodies.
Right.
To our TCJ Co'LAB viewers, we welcome you to stay locked in, open up, and hear what the Spirit of the Lord desires to share in this segment. So Romans 8:37, again, y'all gonna keep hearing that, right? Declare we are more than conquerors. Right? So we are more than conquerors according to that scripture. So in the context of breaking free, we are gearing up to discuss what it practically looks like to adopt this more than a conqueror identity. So let's get this virtual discussion started. And we're going to begin with our physical wellness journey tonight and how family dynamics influence and shape our views on health and wellness. And so we previously shared how TCJ's core mission is to explore how we may unknowingly repeat unhealthy patterns from our family of origin and our upbringing, and the vital need to break those cycles for our overall daily health and well-being. So here's what I've learned, ladies. Health and wellness has an inheritance. And what that means is that what we learned and what we didn't learn while growing up, our family of origin, is what we're more than likely to repeat. Would you agree with that?
Absolutely.
Yes.
And so personally, I can recall observing clearly unhealthy ways of responding to physical wellness in my family lineage. And then growing up into adulthood, I witnessed further dysfunctions within my family as it relates to physical health. So Kim, let's start with you this evening. As you reflect on your family of origin and your upbringing, what kind of physical health related dynamics did you witness, both healthy and unhealthy? And how did those experiences shape the way you approach your own health and wellness today?
Absolutely. So for me, it was a duality. I was born and raised Camden, New Jersey. I saw my mother, who was from North Carolina, got moved up here. She grew up with those Southern traditions, right? Those the eating habits, the recipes, the smothered. Even though we had collard greens, it was overcooked and smothered, and
yes, we know,
right? But my mother, somewhere along the line, decided that she wanted to eat a little healthier later, right? And so with me and my sister, we had a what they would consider but we always had a small starch, a meat, and a vegetable.
Yeah.
And usually vegetables. She always gave us a whole lot of vegetables. So even though she kind of had this experience that she kind of taught us something different. However, around my whole family, they all ate the same, right? They always had food that was maybe the food was overcooked and didn't have a whole much a nutritional value, but it was part of them coming together and breaking bread at the family table. One of the things that I had to learn that I did not pick up is this whole working out regimen. There wasn't anybody in my family that exemplified that. And so the one thing we talk about in healthcare about that inherited gene, like you have certain genes, right? And you may have a particular disease because you had parents or grandparents that had it, right? But one of the things that I think we have to also talk about is that learned behavior, right? Learned behaviors are things that may not always have to do with genetics, but have to do with this is how I grew up. This is the culture, right? And we don't talk about it enough. There are certain cultures that are strong in families that now behaviorally and when it comes to what we do on a regular basis, it's hard to break it. right? And when we talk about educating about healthcare and the importance of eating well and exercising, that's just something it's hard to do because culturally, this is part of our culture is what we do. And so for me, I had to be really intentional about what it looks like, not just with me, but with my kids, because I am determined to have a prosperous life, not just, I'm not talking about finance, I'm talking about health.
Right. That's right.
Health is wealth. Health is wealth.
It means that, you know, we're people of faith, but that means faith is something I got to do. So pay attention now to some of those tools were given as a child, but now I am intentional about how I eat. I work out on a regular basis, you know, and I just try to make sure that for the next generation, and I pay attention to what I'm teaching my kids. And I'll tell a quick story. Daughter went to her freshman year at LSU in Louisiana, and she was like, "Mommy, there is I can't find not a mango and she's like, we really live in the Garden State." And so it was
wow,
that dynamic. Like, I can't have some fresh vegetables. So it was really, really funny.
Wow. And praise God for your mom being the cycle breaker. That's what I'm going to call her.
Yes. That's
so how she came to that, like you said, somehow she came to that decision that she wanted to eat healthier, but that's where the cycle shifted to a healthier cycle, right?
Absolutely.
Absolutely. Yeah. And Dr. Naomi, same question for you as well. What kind of physical health related dynamics did you witness, both healthy or unhealthy? And how did those early experiences shape how you approach your own health and wellness today?
Okay, so I have, my father is from the South in Georgia, LaGrange, Georgia. And they cook the collard greens with the lard, frying all the fish, the macaroni and cheese with all the extra cheese in it, and the okra, the stewed tomatoes, the pig's feet, the chitlins, like all of that. All of that. Well, my father came up from the South, and so he had that dynamic in his family for the way that people cooked. But my father was also an athlete, so great physical health. He was when he was in college, he ran track, okay, and he played basketball and he swam. My father did a lot. He was very athletic, so he moves up north to New Jersey. And married my mother. Well, my mother came from a family where they ate more healthy, would you say, than they did down south. And so my mother would, and we also come from a family of very outspoken Amazon women. And so my mother just wasn't having it. She's like, I'm not cooking that for you. Number one, it's not healthy for you. Number two, I don't even know how to cook chitlins and pig's feet and all of that kind of stuff. I'm just not eating it. And so even though that's what my father was used to, that is not what my mother was going to give him. And so it's the same. There was always a meat, a starch, and a vegetable. Our meals were always very balanced. Right. My mother made a cake or a pie on Sunday. And when it was done, which is usually by Tuesday, there was that was it. That was dessert for the week, you know. And so we didn't eat a whole lot of snacks and things of that nature. And so in my own household, I saw that we ate very healthy. And so and then I'm also thin. And I used to always people used to always say, you know, how do you keep your figure? And I would say, I can't take credit for this. It's in my genes and chromosomes. It's what I will always say. It's in my genes and chromosomes. But you know what? There was a conscious decision to eat healthy and to do right. Although there are some things that are in your genes and chromosomes, but you still have to decide to eat right. Now, I was a track star when I was in high school. I have my varsity letter in track. But do I exercise? I don't exercise. And I used to just say, oh, it's in my genes and chromosomes for me to be athletically built. You know, I can't, you know, but it is very important to exercise. No matter what your genetic predisposition is to be thin and to appear healthy,
Appear.
You should
Ooh, that's
appear
good.
healthy.
Come on,
To be thin and appear healthy, because you can appear to be healthy and your blood sugar is off, your cholesterol is high, your triglycerides are high. So you can't just, look at somebody and tell that they are healthy in all ways. And so it was a conscious decision for me to continue the good eating habits that my mother decided that she would instill in us, knowing that even, that macaroni and cheese that has 5 different kinds of cheeses in it, we might not need to have all of that cheese. There's a lot of cholesterol. There's a lot of fat. There's a lot of carbohydrates because of the pasta, the macaroni that's in there. And you have to really think about what it is that you're eating. Yeah, you can eat chitlins. I don't eat them. I'm not going to eat pig's feet. I don't like okra. Like, there's just some things. It's like, are you really Black? Can we take your Black card? Well, I do like collard greens, but there's a certain way I'm going to cook them. And yes, I am Black. And I might have some tilapia with it. Or I might have a barbecue turkey wing or something like that. I do think that you have to find balance. I don't care what it is that's in your life. You need to find balance. You can eat the bad stuff sometime, but it should not be the majority of what you eat. And I have to say this as a physician, and specifically a pediatrician, I see children and the eating habits that the parents have, and how young the children are when the parents force that on their children. Even when we're talking about in the first few months of life, when babies have to get vaccines, okay? They have to get their vaccines. So what happens when you get a vaccine? You get stuck with a needle, right? And what happens when you get stuck with a needle? You cry and it hurts. So the parents want to let me get this bottle ready, shaking up the formula, getting the bottle ready so that as soon as the child receives the vaccine and they're crying, they stick a bottle in their mouths. And I say to the parent, your child is not hungry. The formula is for nutrition. That is food. So what you're teaching your child in the very first few months of life is that they are supposed to treat their pain with food.
That is good.
Food from the very beginning. And I said, your child needs to be able to understand what pain is and how to manage and comfort themselves through the pain, not with food, And so parents, and then they look at me like, I didn't think about that. It's like, your child's not hungry.
Right.
Why are you shoving a bottle in their mouths? From a very young age, it starts.
Maybe a pacifier.
Very young age. Maybe a pacifier. Maybe or maybe you cuddle your baby and you let them know that it's okay. I know that it hurts, and you nurture them in that way so that that's how they learn to deal with pain. And they know that they have a parent there that they can depend on to comfort them and soothe them in their need of something that they don't, a painful experience that they don't understand. But even then, that's the first experience that some parents use food to soothe something that's hurting them. And they don't even realize they're doing it.
They don't. And that's very profound, because even as adults, we learn to treat our pain with food. So even as we're continuing our journey by identifying the dysfunctions and the root causes, that's definitely one of them.
Right there.
Referred to as the why aren't we conquering phase. So in this phase, we want to further understand the current landscape of healthcare and lay bare the systemic issues of like this prevailing sick care model, which often focuses on treating symptoms rather than preventing disease, which contributes to people feeling disempowered or unable to conquer their health issues. And then looking beyond individual choices, it's pretty recognizable that there are major societal and environmental root causes that contribute to widespread health challenges. So, Dr. Naomi, from a medical perspective, what are some of the most significant dysfunctions or gaps in our current healthcare model that prevent people from truly achieving optimal health and wellness rather than just managing illness?
Well, first you have to start with social determinants of health. And people having less access to healthcare. If you are on less access to healthcare, number one. Number two, the type of insurance that you have, because people do treat you differently if you have state insurance than if you have commercial insurance from your employer. They just do. Where you live, a lot of places there are food deserts. And if you're living in a food desert, you're not getting healthy food. If you're living in a food desert and you're not having healthy foods, and that leads to dis-ease. And when you have that dis-ease, then you have the stigma that goes along with that. You have healthcare providers who don't look like you, who are not empathetic, who don't care to know what your particular struggle might be. You walk through the office and you think that you're coming in to see somebody who is just saying, I don't know, let's just say that they just had a headache and they're coming in for a headache. Well, there's a lot of reasons why you can have a headache.
Right.
You know, what are the stresses that you went through just in your day? You know, what's going on at home? What's going on at school? Can you pay your bills? Are your children hungry? Are they eating in school? Are you hungry? Did you skip breakfast because you didn't have food to eat, didn't have time to eat? Or did you skip breakfast because there's just nothing there to eat? It wasn't by choice that you're skipping meals. And so we really have to think about in healthcare, when you have a patient that's sitting in front of you, people don't just come in isolated. You're a whole person. We don't have enough time. We're not given enough time to really delve in to see our patients, You know, you have to learn how to see beyond.
Yes.
And that's part of the art of medicine. You know, we can all practice the science of medicine. We can go to medical school. We can learn volumes and volumes of information that we learn about disease, and we can sit and take our boards and we can be board certified. Wow. But that's the science of medicine. Right. So you can have somebody who graduated at the top of their class. You walk into their room, they have no bedside manner. They don't know how to engage with you. They don't know how to ask the right questions. If you don't ask the right questions, you will never know what is truly going on with your patient. They may come into the room with one thing, and if you ask the right questions, you can get to the root cause of something else. And there's always a root cause. They come into the room with a symptom, and we need to try to help them find what is the root cause. If we can deal with the root cause, we can alleviate these symptoms that you have. But we have to be able to see the person who's sitting in front of us, and we have to be able to hear what it is that they're saying, sometimes non-verbally.
Right.
Woo.
Yeah.
Wow.
Yeah.
That's heavy.
Yeah. So Kim, from the same perspective, what are some of the most significant dysfunctions or gaps in our current healthcare model that prevent people from truly achieving optimal health and wellness rather than just managing illness?
Dr. Naomi hit it right on the head, and I just want to celebrate her as a health practitioner for the last 30 years.
Yes.
Physicians all the time on their quality improvement. The fact that you talked about social determinants of health excited me. most clinicians don't always know about it, right? Those non-medical factors and drivers, right? It doesn't always have to do with the physical body. It has to do with that emotional, that social. And she mentioned it, that lack of access, transportation, right? People, grandparents taking care of their grandchildren, and they have to navigate being able to take care of themselves on top of taking care of young kids that are in a whole new generation with phones and all of those things. As well as ensuring and I know you guys did it on 2 episodes ago about mental health.
Yeah.
And we're really diving deeper now around that whole mind-body connection. And the effects of trauma and of the emotions and dysregulation around that. And so those non-medical factors are exactly that, not being able to see someone that can speak to you. One of the things I train my staff in, and I tell them, we know medicine, right? We know nursing, we know medicine. The patient knows themselves. They live with themselves for 30, 40 years, right? True teamwork means those 2 things come together. And that means there has to be a lot of listening. And Dr. Naomi said it. You got to ask those questions, right? Because a lot of times the culture and what goes on, right? People that are Black and brown don't always know how to give a good history of what went on.
Absolutely. There you go.
And it's also fostered by some cultural things, because there's things we don't talk about, right? We don't talk about certain things that come out of our house.
Right.
And so being able to make sure that you're able to ask those questions and get to the root of it is imperative. And so part of our job as healthcare professionals, it really is to support that dynamic. My job is to work with the team to make sure that they understand, hey, the nurse, the physician, the patient, right? The patient just as important. We know medicine, they know them. And so whatever the disease is, they got to drive in the car with this disease for the rest of their life, right? So they got to make the decision, are they going to drive or is the disease going to drive? And so part of that is our job is really to support that. So they're able to make decisions to say, yeah, I want to take this medicine. I can't take this medicine. I can afford this medicine. I don't afford it. And understand. And that's a very difficult thing to do.
Wow. Wow. So I feel like we're right there in that sweet spot where we were just talking about, some of the causes, right? So factors like stress and lack of sleep, poor nutrition, right? That contribute to our health challenges, right? In ways that often go unaddressed in standard medical visits. Dr. Naomi hit it, right? Not asking the right questions, right? And you find that, Kim. So in addition to that, we have to keep in mind that health literacy, or the lack thereof, often plays a role in a person's ability to take ownership of their health journey. And I think you hit that too, Kim, in a way of speaking. So Kim, what are some of the other significant barriers or root causes that prevent individuals from consistently adhering to healthy habits or successfully managing chronic conditions? Like, what are some of is it resources, knowledge, motivation, psychological factors? Like, what are some of the other, significant barriers?
All of the above. All of the above.
All of the above.
Health literacy is a big one, right? Because health literacy doesn't have anything to do with your education. It has to do with your ability to navigate the healthcare system. And so people who are PhDs who call me like, Kim, I don't know, what am I supposed to do, right? Because it is completely different. And I know it's relatively recently that health literacy has been a buzzword, but in public health, we've been talking about it for decades, right? How important it is to give patients the tools they need to navigate. You got to understand when it comes to adhering, and thank you for using the word adherence and not compliance.
All right.
Everyone I know, compliance is a curse word.
Okay.
Yeah, I have bought into this plan that the provider has given me. I bought into, and I'm part of the team that have to work through it. So thank you for that. And so some of the barriers to that is depending on what it is. I've worked in my last 30 years with people with HIV, right? I've developed programs and processes and implemented infectious disease clinics within certain entities. And so for them, it's like, this is a reminder of my disease every single day, right? And so that case, you know, it's hard for them. You know, they have to get other things. They got to work on that whole ability to process the fact I got this, right? Because HIV is the only disease you can get that you know how they got it, right?
Right.
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 You know, they either had sex with somebody or they were sharing needles, right? So
Right.
those are things. And so part of the barrier for them is, you know what, this is a constant reminder. For people with diabetes and hypertension, right? They got to now take this forever. And you got to understand that the people that are diagnosed, right? We talk about disparities, and it's important to understand that people of Black and brown descent, they get diagnosed with these things twice, 3 times, 4 times, 5 times more than others, right? And so with that comes, okay, I don't know how to manage this because I don't have the discipline to do so, right?
Okay.
I don't even know. I didn't do well in math all my life. I got passed and passed, and now you want me to measure out insulin.
Wow.
And so how do we get to a place? And the real talk is providers don't have time. Yes, their job is to educate, but when can they do it? When can they do it? Insurance company only give them 10 minutes in the room, right? And they still got to do it. And so the system in itself is a barrier. The reality is the system in itself is a barrier. And then as Dr. Naomi stated, when you look at insurance plans, right? Depending on the insurance, depending on how the plan is set up, is how that entity gets paid. And so what you have is, okay, I'm not even going to see that group of people, right? So that group of people need to go over to the hospital and get on charity care and those things, because we are not going to bother with it because the reimbursement is so low. And so when you think about the system in itself, the healthcare system is, like you mentioned, it is a sick model. So people are sick. When we talk, I'm a public health girl. I'm always talking about prevention. Prevention. In every entity I'm at, prevention is worth a pound of cure, right? But there is no money in prevention, right?
Wow.
Prevention, you got to pay out your pocket for, right? The system is set up for us to not push prevention, but to push this sick model, because that's where the money is. That's where the drugs come in. That's where it is. But the barrier starts with the system in itself, right? And then after we get down from the system and we get to the patient level or the population level, right? There are barriers within cultures, within races, right? That then become influential. And then within homes, right? You have a doctor that says, go walk every day because, you know, you need to get the exercise. But I live in a neighborhood that all they do is they're shooting guns. So how are they expected to walk in their neighborhood, right? So providers come in sometimes with their own perception or their own experience, and then expecting clients and patients to follow that model, when we really need to understand where they are. If there's someone that they can't walk every day, or they can't afford proper sneakers because they need to have proper socks and sneakers if they're diabetic, right? But they're small and they're rubbing, and so they're going to get an ulcer, right? But they don't think about that. They say, yo, walk, put the sock, you know, you have providers even the diabetic comes in the office and they don't even take the socks off to check on their feet.
Wow.
It's a little operational thing that has to be implemented, but sometimes it doesn't happen. And so when you talk about, I could talk about that all day, the barriers, right?
Yeah.
How do we take the research that's been done to improve healthcare, especially in certain populations, because there is a disparity in certain populations, whether it's the system, whether it's the culture and the environment they're in, whether it's violence in the area that affects their health, or if it's just the provider not being able to relate. So we can talk all day. The key is being able to identify that, and being this right here is the perfect place, because we're talking about it. We're talking about these barriers. We're talking about what is needed for all of us to raise the bar when it comes to health and the health of our communities and our families.
Absolutely. And I want to come back and do some more chit chat on that preventive care. So I'm gonna stick a pin in it. But Dr. Naomi, do you have anything that you would like to add to that question?
Yeah, so as she was speaking, I was thinking about, sometimes sometimes it is a person's state of mind. Okay, it's, well, everybody in my family has sugar.
Mm.
You know, this is what happens. Everybody in my family has high blood pressure.
Mm-hmm.
So if this is how it is, you know, I'm gonna eat what I want to eat.
There you go.
Drink what I want to drink. I already have it. I'm 100 pounds overweight.
Mm-hmm.
Literally, I'm 100 pounds overweight. How am I going to get this off? You want me to start walking? You want me to start eating right? Well, how long is that going to take?
Mm-hmm.
I don't have time. I've lived with this all this time.
Yeah.
I'm just going to keep doing what I'm doing. And then they get complacent.
Yeah.
And then there is, in fact, the ability to pay for medicine. I had a patient who came in for her well checkup. She was 10 years old and probably 30 pounds overweight at 10. And at 10, that's a lot of extra weight to have on. And she has asthma. So even though it was a healthy check, she wasn't coming in because she was sick, but we had to fill out a questionnaire because she has a chronic disease, which is asthma. And when I looked at the questionnaire that she filled out and I saw that her score was a 15, that means that her asthma is not controlled. Wow. And so I started asking her about, you know, oh, well, you know, you say that your asthma bothers you every day. And then her mother said, yeah, sometimes when she's sleeping, she's waking up and she's coughing. So I said, you know, your asthma is not controlled. And the mother was telling me that the child was using her rescue inhaler nearly every day. And I looked in her chart and she had a preventative medicine. And I said, well, why aren't you taking this? And the mom said, oh, I don't have that. I said, well, you have it in the pump form and the form that goes into the nebulizer machine. You don't have either one? Her response to me was, Dr. Hill, that costs too much money. I don't have that.
Aww.
And yet her daughter's asthma is not controlled. And for me to explain to the mother, this medicine is a preventative medicine that you should give her every day so that she doesn't need her rescue inhaler. It's not normal to rescue your asthma. You need to keep your asthma under control. And just a lot of times, just to be able to teach the patients, we prescribe medicine and we say, yeah, take this one when you're wheezing, but take this when you're not having any symptoms. Well, who wants to take medicine when you don't have any symptoms? Because they don't understand what a preventative medicine is. And for them, and then for the mom to say, okay, mom doesn't have asthmatic lungs, her daughter does. She doesn't have any idea what her daughter is experiencing. She just knows, I can't afford to give her this medicine, so we'll just give her rescue inhaler while her lungs are just becoming more and more inflamed, making her asthma worse. So you get the person who is the adult who has the condition and makes a conscious decision that I'm going to live with this because this is how I am. I've lived with it this long. I can't get the weight off. I can't get well, if you get the weight off your diabetes, you'll take less insulin. If you get the weight off, if you have type 2 diabetes, you might be able to get off of that pill. Your blood pressure will be controlled if you get the weight off. If you exercise, when am I going to do that? You're asking me to now put extra things into my day. I don't have time to do that. So you have the adult who's making a conscious decision that I'm just going to sit where I am in my comfort zone. And then you have a parent who really doesn't understand what their child is really going through, but their pocketbook says, I can't give her this medicine that she needs so that she won't have to use this rescue inhaler, 4 times a week.
Father.
Mm-hmm.
We have a term that we use here at TCJ that's uncomfortably comfortable, which basically means complacency.
Yeah. It's a mindset. Yeah. It's a mindset.
Absolutely. Preventative care can be approached. It can be approached with a conqueror's mentality rather than simply just avoiding the illness, right? Mm-hmm. Or at least trying to. We are truly more than conquerors when we foster a mindset to be active participants rather than passive healthcare recipients on our health journey, right?
Mhm.
So, you know, Kim, I want to pose this question to you because I know you're in that space of consulting healthcare professionals and all those things, and so, and even healthcare advocacy. So, from your perspective, what is the role of patient advocacy in empowering individuals to navigate the healthcare system from a more holistic approach, mind, body, and spirit, like we spoke about earlier, and truly conquer their health challenges?
Absolutely. I think it starts within, right? It can't be, we're all patients somewhere. That's where it starts. Right. So no matter where you are, I am a patient serving a patient, technically, right? And so when we take that approach, right, we have to think of our own mindset, the things that we don't do well, the things that we may forget to do.
Yeah.
And when it comes to advocating for patients, that's where it's really kind of from that servant kind of, I got to walk a mile in their shoes so I'll be able to understand it, right?
Yeah.
And it's important, right, to understand that we have patients that, and I'm gonna keep bringing it back to trauma and lack of understanding or lack of support, not trusting the healthcare, healthcare delivery. All of these things are factors, right? And all of us are patient advocates. We're either advocates for ourselves or advocates for our children, advocates for our parents or someone. And so it starts with we don't always have the answers. And even though I got all the degrees, right, to a bachelor's in nursing, bachelor's in public health, master's in public health, all those things.
Right.
When I see someone for the first time, even though I have all that knowledge, I got to hear what they have to say to be able to support them. And that's really what it's about. The support that we give as advocates, as patient advocates, really comes from our ability to understand, there's all these factors and there's all these drivers, but the person in front of me is the person in front of me. And if you've just met a diabetic, you just met that diabetic, right? If you just met a drug addict, you just met that drug addict. And the person in front of you has their own story. They have their own life and understanding. Their experience they may sound just like the one that you just heard from, but it is not the same. And
Right.
It's really about meeting them where they are, listening to the story, and then taking all those 30 years of experience and all the degrees and all the processes and bringing them together so then that I can support them where they are, right? As well as, right, it starts with the mind. It also starts with the spirit.
Absolutely.
Our spirit man. So and so it's important that and for me, and I sometimes get in trouble at work about it, but I'm praying with the client, I'm praying with staff, I'm praying with everybody, and I'm declaring. And so, and it's important because sometimes our support needs to be, don't say that. Don't. My biggest people that know me is like, don't you speak that over yourself. I don't care what.
Accountability in that.
Power of the tongue. So if you are kingdom citizens, we have been given the authority.
Come on, right? Yes, ma'am.
That's the thing out down here to bring a thing up down here. So if we got that authority, why are we now saying, yes, I understand you got a diagnosis, and that is true. However, we don't do things. We don't go by this economy. We don't go by this world. We go by kingdom as kingdom citizens. So that means that we got some benefits.
Come on, ma'am.
That we have a part of that. So part of that is supporting you spiritually to help guide you so you can help build your faith. So you understand there's certain things that we got to do. There's certain things that you got to do, and there's certain things you got to say and not say. And so for many people that know me, I'm going definitely, you tell me, Kim, I ain't got no insurance. I'm getting you an appointment. You'll have an appointment the next day because I've been blessed with those type of connections. Also, as a person of faith, they're going to say, okay, I understand that the diagnosis is this, but what are you saying? What's coming out of your mouth? Out of your mouth. I need you to connect with the authority you have. And so when it comes to patient advocacy, for me, it's both. It's the physical, right? Because, it's the mind, body, will, emotions. I get it. It's that, but it's also the spiritual, and how we support people in their spiritual journey of healing.
Yeah.
And people look at me like I'm crazy. It's okay. I'm used to it.
No, because our Bible answers a question. Now, whose report will you believe?
Yes.
We believe the report of the Lord. Yeshua.
Right.
Okay.
And so if he is Jehovah Rapha, that ain't just a name, right? That is a
healer.
It's a healer. That's an ability. That means I can connect directly to Jehovah Rapha.
Yes, the great physician.
To speak a thing until it is a thing. And I'll give you my own testimony. I had this issue with my arm. Like, I work out, and I was so frustrated. But I'm not gonna speak nothing. But I kept having this pain.
Right.
And I go to a church that, at when we take communion, one of the things they say is, if you have pain, raise your hand. So of course I was like, I raised my hand. One time that we did it, they asked people to come up to the front, and I went up to the front, and I've been declaring and decreeing and praying and doing all this stuff, and I was still experiencing it. And I touch and agree with one of our leaders, and the pain, gone right then and there. Don't you know, maybe a couple days later, I start feeling it again.
Okay.
The Holy Spirit said to me, said, I need you to experience this, because what happens is people go to the altar, they get healed, and then they feel it again, and they start speaking, oh my gosh, I got this. And so I was like, oh my goodness, Lord. Okay, I got you. Right? And so, because that means that, but what that does, it says that he is not the authority that he said it is. That means that every stripe that he took on the cross, every whip, that means that actually isn't true. And so, so part of it, and I don't want to get too into this part, but part of it is, yes, we have a physical, but we also have a spiritual. And what are we doing?
Yep. Ooh. And you know what? Knowledge is power. And, so God gives us the ability and the ability to gain the knowledge and the wisdom and the understanding so that we can pour it out into people, into his kingdom.
Absolutely.
And so you have to know what it is that you're declaring and decreeing. You have to be able to identify it. So yes, you need someone to tell you what the diagnosis is so that you know how to pray.
Absolutely.
If somebody gives you a diagnosis of cancer cells in your body are very different than if somebody gives you a diagnosis of Crohn's disease or celiac disease or sarcoidosis. Okay. So you have to know what it is so that you know how to declare and to touch and to agree for your healing.
Absolutely.
And to know whose report you believe. Yes. Absolutely.
So you have to speak to it. You have to speak to it.
I love it. Whose report will we believe? Whose diagnosis will we believe? We believe the report and the diagnosis of the Lord. He says we are healed.
Right. Yeah. And you don't say, oh no, don't say I don't have cancer. I don't have cancer. You do.
Okay.
You do.
Okay.
Except that you do, so that you know how to pray for it. So you know how to pray about it. You have it in your body. It's in your body. It has been found, but it doesn't mean that it needs to stay there.
Come on. All
doesn't
right.
mean that it needs to stay there. And just because you say that you have it, a lot of times sometimes we're just so heavenly minded and we're no earthly good. And just because you say that I have cancer, I have cancer in my body. I understand that I have cancer in my body, but I also know that I am healed. By his stripes, I am healed. And I know how to speak to my body, speak about say that the things that you do not have as though you have them. It's okay to do that, but we need to be able to identify what it is that we have or what it is that somebody else has. If you ask me to intercede for you, if somebody says, can you pray for me? I just went to the doctor and I'm just not feeling too good. I can pray for you. because you're not feeling well and you went to the doctor and you don't know what is going on.
Yeah.
But if you tell me that you were diagnosed with colon cancer, well, as a physician, as my superpower, I know how to pray specifically to that colon cancer because I know what it does in the body. And so as a physician, my prayers can be, it can be different than somebody who might not be a physician, but I need to know what it is I'm praying for so that I could be strategic about my prayer.
That makes sense.
Yeah. You have to have a strategy. You have to have a strategy.
There we go. Yeah. That's right. That's right. And we're already talking about practical steps and strategies. And I think that you both may agree that many other medical professionals and healthcare advocates could become better partners in empowering patients to be more than conquerors rather than just prescription-based care. So in addition to what you both already shared as practical steps and strategies in the spiritual, what is another 1 or 2 actionable steps that we all can take this week just to begin to embody a more than conquerors approach to our health, even amidst the existing health struggles?
Wow.
I can go. I think some of the things that I think have worked for me have been, and that I've shared with others, is a tool that you can do first thing in the morning, right? Is to take a moment to take a deep breath after you thank God for waking up, wake you up, get you out of bed, right? Deep breath and just have a time to just think about your day. I think sometimes we are in such a rush and we have so many things on our agenda that we really don't take the time to kind of prepare for our day. And so, you know, as we talk about this mind and body and spirit and all of that, part of it is something as simple as doing your checklist. What is it? What are those top 5 things I got to get done today? Let me write that down. Don't just say, oh yeah, I got to do these things and just kind of put it in the back of your mind. Because you know, when stress and the busyness of the day, you ain't going to remember them. Right. So just writing those 5 things down, because guess what? You can avoid stress. You can avoid, oh my goodness, I was supposed to have this deadline done. It's a very simple task. And it's so funny because as a kid, I saw my dad do this on anything. He would take a tissue and write down what I'm like, why he always writing this stuff down? But now that I'm 51, I know why he writing it. You ain't gonna remember. But you know, as simple as let me prepare my day. Right? Prepare for my day. And whatever that is, for me, is I got to write down, I got to think about, okay, these are the things I need to do and I need to prepare for it. Just in doing that, my day is a smoother, right? Because things will come at you, but I know I got to get those things done and then I know it's somewhere, right? And now I know, okay, I got to get focused. I got to get back to my computer. I got to do this. Very simple to help you manage your day. And I'm going to say my number 1 thing is my relationship. My relationship is number 1 with Christ. Start my day off. I don't get out the bed until I get out the bed. My routine is I get out the bed, I go to the bathroom because I told you I was 51, and I pray and I stretch. My day, that's my day. That's how I start it. And being able to feel myself spiritually, but I also need to be able, because I'm getting older, and I do not believe just getting older means I'm going to slow down and get stiff and all. I'm not doing that. Right? I eat a certain. I make sure I move my body. I stretch. Absolutely. Sure that, you know, my range of motion, I'm able to stand. I pay attention to my posture. All things that I know I was told as a kid, but I don't understand. I guess you get a certain age and pay attention more. Right. So, I'm engaging my core. I'm doing all this stuff throughout the day, right? And just making sure that I do those things. So those are things that I said, you know, I do it and I share it with people because I think it's important. You know, that we do just a simple thing, a little thing, the trajectory of that.
I love it.
Okay, so I have 3 things. Yes, and I guess two of them are, you know, I can never take off my physician hat. I can't. And then the other one is like a busy mama hat, busy with all your hats. You're a mother, you're a wife, you're a professional, you know, you have things that you want to do for yourself. So Kim talked about what she does in the morning. And so I want to take it to the end of the day. One of the best things you can do for yourself is sleep.
Nice.
One of the best things you can do for yourself is sleep. Sleep to me is self-care. And for me, I'm gonna need 7 hours. Okay. I like 7 hours, but I say wherever you are, add an hour to it. And the reason why I say that is because the busier you are during the day, for somebody who, take somebody who happens to be retired and they are spend most of their days, you know, I'm talking about somebody who's truly retired, who spends most of their days in leisure. Okay. Your brain is active, but it's not active to the point where it needs a lot of time for recovery. But for people who are working, you're going out to work, you're working outside of the home. When you come home, you have to work when you get inside of the home. Your brain is active, active, active. When do you think your brain has a time to rest and recover? It does it when you're sleeping. And so the more you are causing your brain to work for you during the day, the more hours you need to allow it to sleep, to rest. And so that is recovery. If you think about if you're studying for like a really big exam that takes you multiple weeks of study, prepare, take the exam, you are absolutely exhausted. And what do you want to do? You can sleep. And you can sleep to the point where you're like, oh my God, I can't believe I slept that much. Well, guess what? You engaged your brain to the point of exhaustion. And so even during the day, if you're not, and some of us are going to bed exhausted. Some people work 2 jobs because they have to. You're working 2 jobs, you're coming home, you're trying to prepare for your family. You may have children that you have to do homework for. And let's take it another step. You might be that woman who was pursuing, where you have a job and you yourself are in school and you still have a family to prepare for. You're burning the candle from both ends, as they say. You need to get your rest. The way your body heals, the way cells recuperate, is when you are resting. So sleep is self-care. You need to try to get to 7 hours of sleep. Wherever you are, start by adding an additional hour. That's number 1, sleep. Number 2, you heal your body from the inside out. So this means getting rid of toxins. One of the best things you can do for yourself is drink more water. I'm not going to tell you how many ounces. Well, the rule is usually, to be honest, it's take your body weight in pounds. So if you weigh 100 pounds, divide that in half, is 50. That's how many ounces of water you should drink. Whatever your body weight is in pounds, you should drink half of that in water. And how do you know you're getting enough water? You need to have a bowel movement at least once a day. Twice a day would be great. So let's get our rest, drink more water. Everybody has access to water. Drink your water until you have a bowel movement at least every day. And then you at least know that you're cleansing your body and that you're getting a lot of toxins out. So those are 2 easy things that you can do. And the third thing I would say is begin to listen. Listen to if you're driving in a car, if you don't have a car and you have to take a bus, anytime you are in transit from one place to another, listen to an audiobook. If you don't have an app that gives you an audiobook, go to YouTube and find relaxing music, or if there's something that you want to learn about, find a podcast or something, but listen in your car, listen as you're walking around the house. When you're cleaning, you would be surprised. If you have a book, let's say the audio book is 8 hours long, you would be surprised how much you can gain by listening to things that are on audio, more so than you say, I don't have time to sit down and read this book for an hour. But you're cleaning the bathroom, you're vacuuming floors, you're washing laundry. Listen, and depending on what it is you want to learn, whatever it is that you want to get into your spirit, if you want to listen to the Bible, if you want to listen to music, if you want to do a self-help book, whatever it is that you think that you would want to get into your spirit that you just don't have the time to do, try listening. So those are the three things that I would say that you can do to help conquer, you know, some of these things. You need to be in good health, and those are really good ways to be in good health.
Oh, I love it.
Yeah, that was awesome. Very
accurate. Me to have to go back to my audiobooks.
Right?
I listen to the podcast, you know, but you know, I got to go back to those audiobooks, like you said, while I'm cleaning, while I'm moving.
Yeah.
While I'm moving. Yeah, I got to catch up on them. Yep.
So many of us who understand the word in the scriptures, right, know that more than a conqueror doesn't always mean a complete physical cure, and that it can also mean simply finding our peace, finding our purpose or strength within persistent health challenges. So as believers, the power of our creator and source within us can cultivate resilience and inner strength to overcome any setbacks and maintain our healthy journey when things get tough. So for the viewers who are facing like chronic or seemingly insurmountable health conditions and situations where a full cure seems impossible through medical technology, or their healing seems delayed, how can they further understand and embrace that they can still live the more than conquerors reality through the spirit and resilience without falling into denial about reality, their health?
And I think Dr. Naomi touched on it a little bit earlier.
Well, one thing I say is, it's not a morbid thought, but it is a truth. Dying is a part of living.
Help us.
Okay, dying is a part of living. And we're not all going to lay down and not wake up. That's not how we're going to leave. And so our bodies are mortal. And we have to, and there are, everyone cannot live a disease-free life and then just be welcomed back into the arms of our creator. You know, and so the moment that we realize that we may have some ailments in our bodies, we may, but the way that you overcome them and that you don't sink into a depression is to understand that we are here but for a moment. Our days on this earth are numbered, and we cannot and we should not expect that we will be in excellent health every moment that we're here. If we did not experience any dis-ease, how could we have a testimony?
Well,
how could we be empathetic?
Yes, ma'am.
You know, how could you have compassion if you've never experienced anything? Yes, I'm not saying that you got to walk in my shoes, but you have to have some turbulence along your journey.
Wow.
Your journey can't just be, you are not exempt. And if you understand that, and we know that, you know, okay, this is happening to my body. I have this, I'm going to accept that this is happening to me, but it doesn't mean that I'm still not going to pray for a healing. God is not going to remove every dis-ease from us. It is not necessary for him to do that. And the fact that we have a diagnosis and he chooses not to heal us doesn't mean that he doesn't have the capacity to do so. It means that he's decided that that is not what he wants for us. You know, you have a thorn in your flesh. Everybody has a thorn.
Everybody has a thorn.
Everybody has a thorn, and it doesn't mean that we're going to be delivered from every thorn that we have. And so we need to be submitted, and we need to be humbled in the thorn that he chooses to give us. Because the thorn that we have and how we deal with our thorn is how somebody else sees him in us, him through us. And so I think that you can become a conqueror in understanding that everybody isn't going to live a disease-free life. And just because you happen to live with some dis-ease doesn't mean that you're not a child of God. It doesn't mean that you have sinned terribly and this is your punishment for sin. That's another thing. We have to stop looking at dis-ease as a punishment that you have done something wrong. God doesn't need to punish us in that way. And so it's all about a mindset, and it's all about a perspective. And once we change our perspective of what we have and how we are going to choose to live, every day that you wake up is a good day. It's a good day. And every situation that you are in, you could be better, but you could also be worse. So that means that you are always okay. You are always okay. There's always somebody who's going to be worse off than you. And don't think the grass is always greener on the other side, because not everything is visible. And so we need to accept the journey that we are on.
There we go.
The task that we have been given.
Wow.
And understand, like you said, everybody who comes before you is not, I might have seen 10 people today who have HIV, 10 people today who have Crohn's disease, 10 people today who have asthma. They are all 10 individual people who happen to have one disease process in common.
Wow.
But they are not the same. They are not the same. And we need to look at our situations, not woe is me, but what is my testimony going to be with this thorn that I have to carry?
Yes.
Wow.
And that's what it is.
You teaching, Dr. Naomi, because everything you just said is enveloped in Philippians 3:10, that I may know him and the power of his resurrection and the fellowship of his sufferings, being made conformable unto his death. That's exactly what you just broke down. How do we help someone else if we're not suffering ourselves? And we it's all a part of us picking up our own cross and to follow him, right? So we're not exempt. We're not exempt.
We're not exempt. We're not exempt.
Woo! Yeah, did you have anything to add?
She don't said it all. She know. I was one of y'all. I was like, I'm sitting here.
Because we know that we're over time. We know what we discussed.
Yes.
But like I said, the Holy Spirit many times will start speaking, and I truly believe that people need to hear this very thing, that we can't look at God any less. Okay, he is Jehovah Rapha, whether he heals us on this side or the other.
Or not.
That's
it. And we got to remember, it's not about us, right? Sometimes we focus on it being about us, but like Dr. Naomi said, that's part of your testimony, right? Part of our ability of getting through is being able to share what we've been through, good, bad, and the ugly. I am now 4 years into a divorce. Never would have thought that would have it. However, the amount of people I've been able to minister to going through, I would have never thought people would want to come to me and talk to me about that, right? Especially
you would not have been relatable in that.
Right? But it is, and people are hurting and broken, but God is using that, right? And so really some of the things we go through is, like you said, it's part of the journey and part of the process. The one thing that Dr. Naomi touched on that I think is imperative is our and our perspective, right? How do we see a thing? What is our perspective on a thing?
That's
and
right.
sometimes we can focus all day on all the things that are wrong in our lives, right? But what does that manifest? What is the fruit of that? The fruit of I'm gonna be miserable, and I'm gonna be miserable to everybody I'm coming in contact with. But if I have the ability to look at, yes, I might have this disease, I might have some issues with my bills, I might have all these different things that even cause us to not be able to be in good health. What we have to do is our perspective, because there's someone out there that has less, right? They have less, right? But my perspective is, what do I got? What do I have?
That's it.
What is it that I can choose to be grateful for? And really just focusing on that to change who we are and change how we think, I think will guide us and where we need to go.
Absolutely. And we're running out of time, but I still both of you, Kim and Dr. Naomi, you already hit on it in some ways, so I'm going to put it out there anyway, just in case you have more to share on it. As individuals, many of us will need to shift from a mindset of being victims of our health circumstances to being more than conquerors of them, like Romans 8:37 says. So, do you have anything else that you want to share and add in regards to the redefining conquering in the context of personal health and wellness, beyond simply being disease free, right? I know you spoke about that just a few minutes ago, Dr. Naomi, that this ease. Well, sometimes we got to walk through that thing, but what does true health victory in our physical bodies look like? I think you already shared that, but do you have anything else you want to?
It really is a mindset. It really is a mindset.
Yeah, perspective.
Change your perspective.
Yeah,
absolutely.
Yeah.
Change your perspective.
I agree.
Especially as believers. Yeah.
And that we're already.
It's almost like I'm sorry, Kim. When you look in a mirror. When you look in a mirror, you actually see the inverse of what you are.
Okay.
Right. It's not a true reflect. Your reflection is never the way you see yourself. When you're looking in the mirror, it's like your right is your left, and your and you know what I'm saying? It's reversed. And so sometimes people look in a mirror and what they see is the opposite of who they really are. And I think that we need to realize that the reflection is not who you are. It's not. It's what you're looking at is the opposite. And so if we need to sometimes not say, well, I want to look in the mirror. It's almost like it's not the mirror that you need to look at. You need to look through your eyes and see the perspective of you looking through your eyes and not at the reflection that you see before you. Do you understand what I'm saying?
I do, because
you're not looking at you. You can't look at you and see you.
Absolutely.
You only look at the reflection and see the opposite of what is reflecting back. You need to look ahead. You need to look ahead, because when you're looking ahead is the perspective that you see, that you choose to see with your own eyes. I don't know if I'm saying it right, but
no, I think you're saying it right. I feel like
perfectly right. Yes.
I feel like what you're saying, if I could sum it up, is that we are spirit beings having a human experience.
Yes.
Yeah, that's why we don't. When we look in the mirror, we don't see who we really are, because we're spirit.
You're seeing the human, but the spirit is what you're seeing when you're looking.
Yes, ma'am.
Yes.
Right.
Absolutely.
You're not looking with your physical eyes. You're looking from within.
From within with your spiritual eyes. Look from within with your spiritual eyes, rather than the reflection where you're seeing your humanity and not your spirituality. Because your spirituality doesn't have a reflection. You can't see that.
My Lord.
You can't see that.
Say so.
And I want to take it just a little, because she just, like we were talking about conquerors, that spiritual that you can't see, right? Yeah. It's already a conqueror.
Well, that's the conqueror.
Able to connect not with what the reflection like she said, that we see what's in front of us, because we're going to see, we're always seeing what's around us, and what around us can be influential and dictate who we are and how we show up and what we do. But it's really about connecting to the conqueror that is within you, because it's already right. It's already created. It was already done. So to be able to connect to that, because that is who in essence you are, even though it may not look like it around us. Maybe you're not walking in it. It is in you. And once you identify what it is, identify with your purpose, and be able to connect that, right? Then those steps are your steps. So thank you, Dr. Naomi. That was good.
Ooh, y'all dropping gems tonight. Amazing. So we are wrapping this up.
Sad. I mean, like when you look in a mirror at a shirt that you have on, and the words and the reflection are backwards. They're backwards.
It's true. Okay.
Yes.
Very true.
So good. That's good.
It is. It is backwards, actually.
And it's backwards for a reason.
Right.
Come on, drop some tea.
Wait,
Come
what's
on.
What's the reason?
It's backwards for a reason, because we're not supposed to be looking at that as who we are. So that's why it's backwards. So when we're on our phones and we're in the mirror and we're looking at something that is not actually who it is, it's backwards, right? What we look like, it's back. It's not who you're supposed to be. It's not how it's not how you present yourself. When we train in DISC, one of the things that we train people in is that you have 3 different ways to communicate, right? You communicate in the way you show up for people. You communicate the way you truly are within yourself and at home. And then you have this mask. The mask is what shows up all the time, right? It's how I navigate around, make sure I don't speak a certain way, make sure that I'm not too loud, I'm not too, right? And that's your mask self. But the reality is that is not who you are. The same is true with your reflection. It's backwards because life technically is backwards. How it is, how it shows, it's backwards. It is not part of how we are supposed to be as spiritual beings. And so you're supposed to identify it and see it as what it is.
Yeah, we're taught at Victory that we live backwards. It's like it's already done. Already spoken about. Yeah, you're just living life backwards from how God already planned.
It's already.
And Jeremiah 29:11 he has for you. Yes,
absolutely.
Yes. And so we are. This is y'all dropping, and it's sad to end this. It really is. But we are moving forward, and we are concluding tonight's amazing empowerment discussion with a call to action. So you all have already pretty much shared a call to action, but what's one final message of hope and empowerment you want to leave with our listeners and our viewers today regarding their ability to truly conquer in their health and wellness? What's one final message of hope?
Dr. Naomi, you want to go?
Out of everything y'all said.
Out of everything that I said,
so much.
You know, just know that we are spiritual beings.
Yes,
we are spiritual beings in a flawed vessel, and just know that your spirit is not your physical vessel. So have hope that if you feed your spirit, if you nurture your spirit is your spirit outside of the flawed vessel that it resides in.
Yes.
I love it.
Yes.
I love it.
I think what I would say is that everything that you are supposed to do and be is already in you. And even though you may not see it and feel it, it is there. And your job is to tap into the God person that you're supposed to be, how God created you, how he fashioned you, how he knitted you in your mother's womb, right? That person, you need to discover who that is, right? Because what we do is we live a life based on our experiences and what we've been taught and how we've been raised and all of that stuff. And that has sometimes can be a little louder in our ear than what God says. And so I say the number one thing to live a conquered life and a life of abundance is tapping in to who God said you are. what he said that you're supposed to do. Because when you do that, doesn't mean life gonna be easy, but I promise it will change your perspective, and what you think fills you, attention, comparison, alcohol, drugs will no longer need to fill you. So that will be what I say.
Awesome. Awesome. Thank you so much. And this has been a needed discussion, a blessing. And I know all of the insight that you both have shared is going to also help someone else to see themselves as more than a conqueror within their current lifestyle and health challenges, along with their healing process. So thank you, Kim, and thank you, Naomi, for taking the time to share your expertise and passion with us in this collab discussion. So in our effort to empower our viewers to connect one-on-one and apply necessary tools that you both taught tonight and your principles that we've discussed, we would like you to please share where our listeners can go to learn more about you and take the next steps in their journey toward being more than conquerors in their health, be it with you both, or if you have other sources or links or websites, such as health insurance, if they can't afford it, or if they have no access to it, or any other type of healthcare screenings and evaluations. Please share that what you can with our listeners, and anything we catch tonight, we can also stick in the link on the upload.
Absolutely.
Great. So you can contact me at Trinity Solutions by Trinity.com. That is my website where you can go and get information. Or if you want to contact me on Facebook, my Facebook page is Kim Cosby McCargo on Facebook, and _ for his glory on Instagram. I am, even though I am a nurse and a healthcare executive, my heart is my heart is for healthcare, for people to understand it, navigate it. So if you are somebody that do not have insurance, please reach out to me. I will navigate you to where you need to go. Most federally qualified health centers are there for people who have little to no insurance. So I can connect you to there. And there are some other entities that decided to have free healthcare if you are in New Jersey. I do have a book, Save Does Not Equal Settle. It is on Amazon. It is about us settling, and enough with us being beautiful and wonderful people, and we settling for less. So if you do want to get the book, you can find that on Amazon. If you search my name, Kim McCargo, or the settling for less, it'll pop up, and I'll make sure that the links, that it will get the links so we can share it out.
Okay. And so I am on Facebook as Naomi Hugh, just Naomi Hugh. And I put a lot on my Facebook page. I am a physician as Dr. Naomi Hugh. I'm in the Advocare system, Advocare Crestville Pediatrics, SKRESSVILLE Pediatrics. If you or Google my name, you'll be able to find me. We have an office in Cherry Hill and in Sicklerville. I'm in Sicklerville 3 days a week, Cherry Hill 1. Sicklerville is my population. I love my patients in Sicklerville. And I'm also a wife and a mother in a blended family.
Yes.
And I wrote a book. This called Blended Beyond Expectation. One, not plural, Blended Beyond Expectation. And it is on Amazon as well. I have a website, www.drnaomi.org, because during a pandemic, I became certified as a family empowerment coach. And so I do things with families and empowerment in that way. So my website, drnaomi.org, Blended Beyond Expectation, and Naomi Hugh on Facebook.
Awesome.
I'm so full. You ladies have definitely just, again, brought all of the professional tools and nuggets and insights that you have and laced it with the word of God to help us understand that He is the great physician. He is Jehovah Rapha in all things. And so I'm grateful. I'm grateful. I am full. I was over here taking notes. It's been amazing tonight.
Yes.
It's been so amazing. So to our professional medical health experts, Dr. Naomi, Hugh, and Kim McCargo, we thank you, ladies, so much for your time, for taking a little bit of time out of your day to just collab with us in our virtual laboratory here at the Conquerors Journey. We appreciate your very much needed pour tonight.
Yes,
my God, if we got something out of this, I know the viewers are blessed and can't wait to connect with both of you. So thanks again for joining us. We love y'all for real.
Yes.
We love y'all for real. So we're going to bid you a blessed night to both of you beautiful ladies. We love y'all so much. Have a great evening. Thank y'all for coming.
Thank you. Bye-bye.
Take care. Well.
Okay.
Here I go again. Last month I was just like, whoo. And here I am. Girl, I'm so full.
Yes, I love their passion. I love their insight.
I love their passion.
I was over here taking notes myself. As I always do. Okay, wait, hold on. Let me catch that. Because I don't want
the nuggets was real tonight. Okay.
Yes, indeed. But definitely to be intentional in this particular conquering of our wellness journey, right? Our holistic health is truly our wealth, like we talked about, mind, body, and spirit. And having these conversations with our loved ones so that these type of healthy practices can be taught from generation to generation. And we touched on that too.
Absolutely.
And we also talked about tapping into the Ruach, tapping into the source within that's already there. So that rightly aligned in the natural and in the spirit. Because the spirit is the greatest counselor, the greatest teacher, instructor within us on this journey. And what the Ruach may lead me to do will always look different from what the Ruach leads you to do, and that's the beauty of having our own spiritual connection. We touched on that as well. And so to be spiritually minded is indeed life and peace. So I pray that each of us discover everything that we need to live our best lives today. And that's one of the mottos I've taken on is my best life is today. Today is our best life, and our tomorrow is a better one. And it gets and better because we talked about that mindset. We talked about the mindset shift and our perspective, right? As we increase in knowledge and every day should be living our best lives. Today is the day. So may we continue to be illuminated in our understanding so that we can bring forth the fruit of the spirit that will be evident because we're putting the work in. So as within, so without.
Listen, and that's what it takes. That's how we become more than conquerors, is by putting the work in, right? I think we've been sitting in John 2 that for all night. Just beloved, I pray that in every way you may succeed and prosper and be in good health physically, just as I know your soul prospers. So as our soul prospers, our bodies will align, right?
Right.
As we prosper spiritually, our bodies will align and will not be perfect in this life. Hello.
Right. We touched on
I love that Dr. Naomi said that. I love
she did.
No, don't expect to have your bodies go through nothing. But truly, as your soul prospers, you will be in good health, right? Not perfect health. It said good health, right? We're still winning. We're still winning in our physical bodies as we prosper in our spiritual being. So with that said, our physical wellness journey discussion tonight truly encouraged all of us as conquerors. I know it encouraged this conqueror here, okay, to think deeply as our medical professional guests shared their professional and personal insights tonight. It was amazing. And so I'm truly grateful for God choosing us, Maya, to spearhead this untraditional platform, right? In order for his voice on some of these daily life matters to be heard and discussed, shared and exchanged in a practical way. This is such an untraditional space, right? Because truly God, truly God has much more to say when it comes down to our physical bodies. I don't know why we feel like, God doesn't care and he just wants our souls to prosper. But truly, although this is going to fade away, he still has much to say, much to share, and wants us to be conquerors in all things, not just spiritually, but in our physical body. So I'm truly grateful for this platform. And so as we bring our June physical wellness journey segment to a close, we warmly remind you all that if you have a willing ear to hear what the Spirit of the Lord has to share on this overarching topic on breaking cycles of dysfunction, we invite you to stay tuned and stay locked in to our upcoming July segment, which is part 4 of our health and wellness journey and all of the monthly segments throughout this 2K25 year. You don't want to miss it. You don't want to miss it. Stay tuned, stay locked in. Holy Spirit, the Ruach, constantly breathing through here. So we welcome you to share your feedback in the comments. We welcome you to share this rich information, priceless empowerment that has just been shared here tonight with others. Don't hog it up to yourself. We always say that here. Share it up. Don't hog it up to yourself. Share it with your family. Share it with your friends. Absolutely. And until next time, we admonish you to think on these things that have been shared here, beloved conquerors. Empowerment blessings to you while on your very own conqueror's journey. The empowerment and journey continues, and we love y'all for real. All right?
Absolutely.
God's peace.
Peace.